Hello guys. So a major problem that medical students face and young doctors face in the clinical practice and their exam is that they do not have enough exposure to CT scans, especially CT scans of brain, which they are expected to have. So I would like to just go through first through CT brain anatomy. Now if you don't know the basics and the anatomy, what you are seeing, what is normal, then you really can't proceed with to find the abnormalities. So let's get started. First and foremost, this is a CT scan machine. I'm sure you've seen one of those in your hospitals. Now, CT is an extremely important investigation, if endo or ER. Now, you need to be able to interpret the findings, at least some of the basic ones, so that you can make some important decisions that demand immediate action. Now, electrical engineer Godfrey Hounsfield, he came up with the idea and the machine of a CT scan. He won the Nobel Prize. There's Hounsfield units that are named after him. We'll get to that in a little while. The principle is that of an X-ray. Now, in a circular path, X-rays are passed through a patient, and then you get a high-resolution scan taken by a computer that interprets the results in a 3D or similar form. Okay, here are some slices of bread and here are some slices of CT scans. So usually you take 5 to 10 mm slices. With the advancement of technology, you get thinner slices and get more information as we go on. So basic CT findings are always described as densities. Now things might be isodense, hypodense and hyperdense. Now just so you remember right now, hypodense would be an area that is, towards the black end of the spectrum, and hyperdense would be an area that is to the white end of a spectrum. So higher the density, the whiter it is. Bones are usually white, hyperdense. Lower the density, the darker it is. Air. Now air is the most hyperdense feature that you'll get. So here, the brain parenchyma usually is the reference density. That is isodense. Anything that is black compared to the brain parenchyma would be hyperdense. Anything that is white would be hyperdense. Now, what are the indications? Stroke, TIA, head injury, hydrocephalus, mental status change, and in things where you don't get an MRI. You can look with an IV contrast CT to look for tumors, infections, and inflammations. Now this is Hounsfield. So what are the Hounsfield unit? They're called CT number. They represent the density of the tissue. Now here we're saying water got an Hounsfield unit of 0. You can use these units because in the computer which you are seeing the CT scan, you get these units as representation. You go to a particular part of the brain and tells you, or any part of the body, it tells you what HFU it is. So an air would be 1000, bone would be plus 1000, this is minus 1000, white matter would be plus 30, gray matter would be plus 45, blood would be 70. So you can differentiate between these features on HFU reading. Now this is what our house officer interns in Pakistan see, just a little bit, and this is what the professor wants you to know. So it's a long learning. So these are the sections that you take. Axial section is the most important, coronal section and sagittal section. Usually most of the interpretations are made by the axial section. So this is the normal anatomy. I need you guys to focus on this. Now this is a slice taken from here. It's a lower end cut. It's showing the orbits. It's showing the sphenoid sinus. It's showing the temporal lobe. It's showing the external auditory canal. Note the air that is completely black in it and communication with the outside, mastoid air cells, and the cerebellar hemisphere. So you can see later on the cerebellum is a little different from the cerebrum right here. Now a little higher cut, you can see the frontal lobe starts appearing around here. You see the temporal lobe here. You see the frontal bone. You see the dorsum cellae. You see the temporal lobe here again. The mastoid air cells. Now this does not have communication with the outside, so it's not the external auditory meatus. And you see the cerebellar hemisphere and characteristic cerebellar features will be seen here. Now, question usually comes, sulci and fissures. Now, a sulcus is depression in the cerebral cortex. If I get a view around here, now this is a sulcus, if you can notice the pen here now, and this is a fissure that's dividing the lobes. Let's come back. A fissure is a large furrow that divides the brain into lobes and into the two hemispheres. Now, a cistern is an opening in the subarachnoid space. Now the arachnoid and the pia, they're separated. These are the things that have cerebrospinal fluid. I'm not talking about the ventricles, cisterns. Let's continue. This is the frontal lobe. This is the sylvian fissure that you see that divides these two lobes. Right here you've got the temporal lobe still, and you've got the suprasellar cistern right here. The midbrain, you can see it is differentiated here. You can see it is surrounded by spaces filled with CSF. Now you've got the fourth ventricle right here, and you've got the cerebellar hemisphere. Now cerebellum, just look at this, it's a little different from what you've got here. Here you've got white matter and grey matter differentiation, here you do not. You go higher, you've got the falx cerebri, it's really important, we'll come back to it later. You've got the frontal lobe, you've got the lateral ventricle. Now these are the horns, the interior horn of the lateral ventricle is making an appearance, with the third ventricle is sit like here. You've got the quadrigeminal plate cistern, and you've got the cerebellum. Right here, anterior horn of the ventricle is making a better appearance. You've got the caudate nucleus, you can see here, something that is a little hyperdense than the other matter. You've got internal capsule, anterior limb, that is right here. You've got the putamen global pallidus, that is here. You've got the posterior limb of the internal capsule right here. You see this is internal capsule, you can see it around here as well. This is the posterior limb. You can see the third ventricle, the quadrigeminal plate cistern. Now you know better about cisterns. And now you've got the cerebellar awareness. Just hurry up. So this is just a small break. If you give science teachers playground duty, this is going to happen. Now you've got genu of the corpus callosum, you've got the anterior horn of the lateral ventricle, we mentioned this. You've got the internal capsule, now you know where it is. You've got the thalamus making an appearance right here as we go higher. So this right here is the thalamus. You've got the pineal gland, the superpower of the human brain. Choroid plexus right here. Here you see where the CSF is formed, and you've got the straight sinus around here. Let's continue. Now this is really important. There are normal calcifications in the brain. Sometimes you see matter that is hyperdense, that is white in the brain, and you see it might be a bleed. That's probably can be something else as well. The pineal gland is calcified, and calcification looks white, as we remember. It is seen in 2/3 of the population and increases with age. The habenula is the part of the limbic system. It is calcified. Choroid plexus is usually calcified as well. Basal ganglia can be calcified. The falx dura mater tentorium cerebelli can be calcified. Superior sagittal sinus can be calcified. Now this increases with age. Now right here you've got the choroid plexus calcified, it's not a bleed. The pineal gland is calcified, not a bleed. Falx cerebri is calcified, it's not a bleed. Continue with the normal anatomy. You've got the falx cerebri that is not calcified here. You've got the frontal lobe again. You've got the body of the lateral ventricle. Now you just don't have the anterior horn, you've got the body as well. You've got corpus callosum connecting the lobes here. You've got the parietal lobe that is making an appearance now here. I'll come to that in a little while. You've got the occipital lobe. Now you see something that is much more like the brain parenchyma. It's not the cerebellum. As we go higher, it is the occipital lobe and the superior sagittal sinus here. Now this is an important landmark that I will mention around here. Let me just go back a little bit. Yeah, these small indentations that you see, this and this, anything above it, it's probably the parietal lobe, and anything below it, it's probably the temporal lobe. So let's continue with just the ventricle system, just a little review. Now you're getting a higher. Now all these items are gone. You've got the frontal lobe, the parietal lobe, the occipital lobe, cerebri. Now here you've got a sulcus, you see, in the brain, a little depression between right here. You've got it as, and thank you. So I hope this made understanding of CT brain a little better for you guys, and we'll continue and come to various pathologies in the next videos. Thank you. Leave your comments and subscribe to the channel, share with your friends.